All right, well, if you're like me, you sometimes randomly cry, like for no reason. We're fine, we're doing great, but safe to say hormones are constantly working behind the scenes, right? Guiding everything from our energy to our mood, sleep, overall health, right? But what our bodies need in our 20s can look really different from what we need in our 30s and 40s and beyond, of course, right? So this morning we are joined by Dr. Joseph Fiore, a board-certified OBGYN right here in Alabama, to walk us through a decade-by-decade guide to hormone health and what patients can do to feel their best at every stage of life. Doctor, thank you again so much. I feel like this is like my personal appointment right now because, again, sometimes we are teary and we got emotions riding up and down, skin issues, all kinds of things. I want to start, though, first by chatting. I think people don't realize hormones can be tested. I think sometimes it seems like kind of something difficult to navigate, but you can run tests just like anything else. Yep. Kind of walk me through what signs might indicate, hey, let's maybe check this out. I know we're going to go through it stage by stage, but just initially kind of what you guys look for in kind of determining if something might be a little imbalanced.
Well, first of all, I appreciate you having me here. I'm excited to talk about hormone therapy. It's kind of one of the things that I specialize in and really passionate about. So for hormones, certainly hormones change as we age, and typically as we age, nothing really gets better. But as women enter their 30s, 40s, 50s, the hormone levels tend to be lower than normal. And yes, to answer your question, yeah, you can easily test estrogen levels, testosterone levels, and so forth to kind of see where women are as far as related to menopause or even prior to menopause. So testing the hormones can be done, and certainly you can treat depending on what your lab results say.
Yeah, certainly so grateful for it. So again, we're kind of going to do this decade by decade breakdown of sorts. We know you see all kinds of patients, but we'll just kind of walk it through here, starting kind of in the 20s, even kind of early 30s time frame. I'm actually told your body kind of changes, I think every 10 years or so, if not more often than that. So kind of what you see patients typically deal with during this time frame and what treatments look like there.
So basically we hit our hormone peak usually about age 22 to 24.
Okay.
After that, it's all downhill to a certain degree. Okay. As women enter the 30s, one of the things you'll start to see are low testosterone symptoms. And those symptoms can range from anxiety, depression, fatigue, poor libido, poor sexual function, poor sleep. And the most common thing I hear is, Dr. Fiore, I just don't feel like myself. And, people describe low testosterone in men, low T in men. Well, it's the same thing in women. It's just a lot of physicians don't understand it or don't really care about it. And in our office, we treat low testosterone for women. So even a woman in their 30s or 40s may be a candidate for testosterone therapy to really help alleviate a lot of those symptoms.
Wonderful. So again, those kind of issues in those kind of 20, 30 time frame. You mentioned even kind of 40s. Let's talk even 40s, 50s, premenopause, even menopause later on. What are we kind of thinking about?
So a lot of ladies will develop perimenopause before complete menopause. And again, you can still see those same symptoms: fatigue, anxiety. You'll start to see hot flush, night sweat, vaginal dryness, pain with intercourse, recurrent urinary tract infections. And a lot of times that's a symptom of not only low testosterone, but also low estrogen. And both of those things can be treated as well.
Okay, and so with that, again, you mentioned treatment. Let's talk treatment. I think sometimes, again, women are apprehensive.
Yes.
There's so many, when we're dealing with our hormones and minds and emotional imbalances, there's a lot of fear, I think, associated with this. So let's talk different treatment options, how you navigate that with patients.
So the first thing I want to say is, the hormone therapy we use today is extremely safe. Everything we use in our office is bioidentical, whether it's a prescription you pick up at your pharmacy or whether it's a bioidentical hormone pellet that we may insert. So everything bioidentical is extremely safe. None of the hormone therapy we use increases your risk of breast cancer, which I think is the biggest misnomer with hormone therapy is that hormone therapy causes breast cancer. The correct hormones do not do that. The bioidenticals have never been shown to do that. Some of the older synthetic ones did, but the bioidenticals do not. And I think that's the biggest hesitancy for patients not wanting to use hormone therapy is, by gosh, I don't want to get breast cancer. But the reality of the situation is this: when women start hormone therapy during the menopause years, they actually reduce their long-term risk of breast cancer. They're going to significantly reduce their long-term risk of heart disease, heart attack, which is the number one killer in women's. You're going to reduce the chance of osteoporosis or getting a hip fracture later in life, and reduce risk of dementia and colon cancer.
Wow. So again, keeping it balanced as best you can, going to help you on later in life. And with that too, Doctor, I do want to ask, I think sometimes women think, obviously we're talking about hormone imbalances, really the menstrual cycle, right? If they're only experiencing symptoms in and around that time on the front end or the back end, can we still do kind of a year-long treatment, or do you take treatments kind of just in and around?
Well, a lot of women prior to the menstrual cycle, there's something PMS, premenstrual syndrome, or there's another one called PMDD with severe symptoms of anxiety, mood change, just don't feel yourself. Yes, you can mitigate those symptoms, and there's different ways to do that. You can use some low-dose anti-anxiety medications just during those days where you don't feel well, but you can also use use estrogen therapy. You can use estrogen just a week prior to that cycle to help negate that estrogen withdrawal, which causes a lot of those symptoms.
Yeah, because it drops right before. I think, again, a lot of people don't realize when you're really studying this, like, ladies, you are not crazy. And with that too, doctor, just as we wrap up, any kind of final word of encouragement? Hormones are scary, they're imbalanced. I think sometimes women think, what's wrong with me? I'm literally bouncing off the walls here. But again, you deal with this daily.
We deal with this daily, and we do tons of bioidentical pellet therapy. These bioidentical pellets that we usually insert top of the hip here. Most patients come in about every 4 months, and I got to tell you, the pellets we used have changed the quality of life for hundreds and hundreds of women, and we've had outstanding resuls with the pellet therapy.
Wonderful. Doctor, thank you so much for coming on. Big question now for women who want to know more, they want to chat with you and even look at those therapy options. Tell us where you're based, what an appointment booking might look like, and where we can get help.
My office is connected right to Huntsville Women and Children's Hospital, 4th floor, suite 400, and our website is alabamawomenshealth.com.
Wonderful. Dr. Fiore, thank you again so much. I myself might have to come see you because goodness knows we need all the help. I'm 28, so I'm reaching the peak and we all need our help. So thank you for coming on.
Thank you very much for having me. I
Likewise.
appreciate it.
Thank you so much.